Can ejaculation temporarily raise your PSA? Have you ever wondered if ejaculation can affect your prostate-specific antigen levels? The answer is yes, it can. Ejaculation can cause a temporary increase in PSA levels in the blood. This rise typically happens within the first few hours after ejaculation and usually returns to baseline within 24 to 48 hours. This effect is particularly noticeable in men aged 50 and older, who are the primary group undergoing PSA testing for prostate cancer screening. Prostate-specific antigen is a protein produced by the prostate gland. Its levels in the blood can increase due to various activities or conditions related to the prostate. When ejaculation occurs, it causes contraction of pelvic muscles and the prostate, which can lead to leakage of PSA into the bloodstream. This results in a temporary elevation of serum PSA levels. The increase in PSA after ejaculation can be significant enough to elevate PSA values above clinical thresholds used for prostate cancer screening. This can potentially lead to false positive results if testing is done too soon after ejaculation. Studies indicate that PSA levels may rise by a few nanograms per milliliter within 1 hour after ejaculation and generally return to baseline within 24 hours. However, in some cases, especially in older men or those with larger prostate volume or urinary symptoms, elevations can persist for up to 48 hours. The magnitude of the PSA increase correlates with baseline PSA levels and prostate size. Men with higher baseline PSA or larger prostates tend to experience greater post-ejaculation PSA rises. Because of this effect, clinical guidelines recommend abstaining from ejaculation for at least 24 to 48 hours before PSA testing. This helps avoid misleading elevations that could cause unnecessary anxiety or additional testing. Other activities that put pressure on the prostate, such as prolonged cycling, can also lead to transient increases in PSA levels. In the context of prostate cancer diagnosis and screening, understanding that ejaculation can temporarily raise PSA is crucial. It helps prevent unnecessary stress or additional procedures triggered by transient PSA elevations that are not related to cancer. Patients are advised to inform their healthcare providers about any recent ejaculation or other prostate-impacting activities before undergoing PSA testing. This allows for more accurate interpretation of results. Repeat PSA testing after an appropriate period of abstinence can help ensure that the results reflected true prostate health. In summary, ejaculation does temporarily raise PSA levels, especially in men over 50. This effect should be considered in prostate cancer screening protocols to prevent false positive findings. Always consult with a healthcare professional for personalized advice and to discuss any concerns regarding PSA testing and prostate health.